Hi Helen, tell me a little bit more about you.
So I qualified as a physiotherapist in 2007, so I've been qualified for about 17 years. Over the years I've specialised in neurophysiotherapy and specifically traumatic brain injury. I also have done a lot in sport and musculoskeletal and specifically rugby. And most recently I've been specialising for the past 10 years in chronic pain. And within that I have been a clinical lead for non-invasive neuromodulation companies, where we've been using electrophysical agents to modulate nerves. One of those at the moment is BioWave, and I've also worked a lot in radio frequency, but non-invasively. And again, I've also done some work in elderly rehab as well.
So what sort of patients would benefit from radiofrequency treatment?
So patients who have got an acute injury, it's amazing for. So we use it in Premiership footballers, we'll have it, and within the first 24 hours of an injury, they'll start on radio frequency in some of the clubs, which enables your body to kind of kickstart a repair process. So it kind of pushes them through that inflammation stage through into recovery and repair. So it's amazing for us getting things healed and settled down really quickly.
So Helen, tell me a little bit more about non-invasive neuromodulation, in particular BioWave. Can you give me a bit more detail on that?
So BioWave launched in the UK about 3 or 4 years ago, but it's actually really established in the USA. It's been in the USA for about 15-20 years and is used extensively in the NFL, as well as basketball. If you Google it, you'll see it. We use it specifically for patients who are in chronic pain, where we need to reduce pain to enable them to take part in their rehab. It's really good for patients who are experiencing chronic low back pain, things like shoulders where we're struggling to manage pain to improve recovery, so within their exercise programs. It's really good for neuropathy, so things like when you've got sciatic nerve issues or peripheral neuropathy. It helps reduce pain in those patients, and it works by sticking some electrodes on the skin, but they work at high frequency, so really different to things like TENS, and it feels really comfortable. It's a really nice sensation, and we also use it within women's health as well, so we can use it for things like chronic pelvic pain and endometriosis.
And tell me a little bit more about the non-invasive neuromodulation.
So I specifically use 2 devices. One is radio frequency, so its other names are TECA, you might have seen in social media or online, and its other names are capacitive resistive monopolar radio frequency is actually our big long title for it. This is where we put an electric current through the tissue, which helps with managing pain, reducing inflammation, but also it helps with accelerating repair of tissue as well, which is a massive thing that I'm interested in. I actually trained a lot of the physios in elite sport in using the device, because I was clinical lead for Europe with radio frequency, so I've got a lot of experience with it and it has amazing results.